I request Dr. Sundaresh to address us.
I offer my humble salutations at the divine lotus feet of our dear Lord Bhagavan Sri Sathya Sai Baba. Respected trustees of the Sri Sathya Sai Central Trust, invited guests, revered elders, dear Sai brothers and sisters, I deem it my privilege to stand before you and welcome you to this global conference on the Sathya Sai Ideal Healthcare Mission. I'm happy to note that the response from the doctors from all over India and some from overseas has been overwhelming. We have over 800 registered delegates. I heartily welcome all the delegates who have registered. This conference is being organized to rededicate ourselves to the Sathya Sai Healthcare Mission and as a part of the celebrations to commemorate the centenary year of the advent of Bhagwan Baba. The fact that this healthcare model has flourished for 7 decades now proves that it is a robust model and that there is an overflowing grace of Bhagavan in this. We don't need to prove this to anybody. About the work being done here is seen in the faces of millions of people who have benefited from it. The goal is to spread this message of love through healthcare delivery and to encourage more and more people to participate in this mission and try to emulate this in their own environments. The Sathya Sai General Hospital at Prashanti Nilayam, which was started on the request of Mother Ishwarama, started in 1956 as a small hospital with 8 beds and has grown to a 120-bed multi-speciality hospital today, offering services to a lot of people in and around this area, catering to almost more than 5 lakh people within a 12-kilometer radius in more than 300 villages. Following this, the Sathya Sai General Hospital at Whitefield was started as a small mother and child hospital to meet the needs of the local population. At that time, Whitefield was not a part of Bangalore city, it was outside of the city municipal corporation. The general hospital, which is currently relocated to the premises of the Sathya Sai Institute of Higher Medical Sciences at Whitefield, served a lot of patients for all these years. Today, the general hospital has an outpatient strength of more than 500 per day and do more than 12 to 15 major surgeries per day in the 4 operating rooms. The thing to note here is that though the services are all free, there is no compromise on the quality of care given, either by way of manpower or by way of equipment. Volunteer doctors of all specialists come to this sacred temple of healing from all over the country and across the world to render their services to the benefit of the patients who come to us. Being a general specialty hospital, it covers all the specialties like general surgery, general medicine, orthopedics, ENT, ophthalmology, urology and obstetrics and gynecology. The hallmark of this hospital from the beginning has always been the number of volunteer doctors who come and work here on a regular basis, but with a fixed schedule as well. This has helped the patients to get expert help in the area of need. During the 65th birthday celebrations in 1990, Bhagwan Baba in his discourse announced and made an astounding declaration that he's going to start a super speciality hospital to cater to cardiac patients at Puttaparthi. This was a surprise to a number of elders around and to the whole crowd that was there, because in a small hamlet in Puttaparthi, to think of building a super speciality hospital for cardiac care was unthought of, beyond comprehension for the normal, but for the divine, it was a sankalpa. Keeping in line with the sankalpa that Baba made, a palatial building of 350,000 square feet was ready, and the first operation was conducted a year later in 1991, and the hospital was inaugurated on the 22nd of November 1991. This was the birth of the third unit of the Sathya Sai Ideal Healthcare Mission. The hospital grew to add other specialties like urology, ophthalmology, orthopedics, plastic surgery, and gastroenterology. The super specialty hospital at Whitefield was started by a similar surprising announcement by Bhagwan in the year 2000. A year later, in 2001, was born a palatial white building of almost 325,000 square feet, which took a year to build, which was essentially meant for cardiac and neurosciences. Both these specialties, when it was started, were led by senior, experienced doctors with state-of-the-art equipment, enabling complex cardiac and neurosurgeries. The hospital is equipped with modern diagnostic equipment and has 12 fully equipped operating rooms to cater to the needs of the patients and to the satisfaction of the professionals operating there. Healthcare at the doorstep. Baba was not satisfied with what had happened so far. So he said we should take healthcare to the doorstep of people who need it. This gave birth to the mobile hospital in 2006, and which provided holistic health care to over 5 lakh people in 300 villages in and around Puttaparthi. This is a very unique model, and I'm sure you'll hear more of it during the deliberations over the next 2 days. The USP of all these hospitals has been what we term today as the ideal healthcare mission of Baba. It has to be universal, it has to be free, it has to be comprehensive, and it has to be given with love and compassion, and it has to include the preventive aspects as well. All these are being done even today with the best of technology in diagnostics and treatment-related equipment. There is no compromise in the material use or that the equipment we purchase. It's all state-of-the-art and the latest. To add to this, I think very few hospitals can boast of a completely paperless outpatient department. All our patient records in the outpatient department are paperless, and we are fully digital, thereby reducing the carbon print of the world. Because the services offered are free of cost and of very high quality, patients from all over the country flock to these hospitals. Thereby, the numbers are large and difficult to manage. But we have overcome this problem and difficulty for the patients to be seen by creating a very robust appointment system. Today, all the patients come to the hospitals by appointment and are seen on the same day that they arrive without having to wait outside of the gates of the hospital. Volunteerism is again the hallmark of the Sathya Sai Ideal Healthcare Mission. We have, as I mentioned, volunteers in doctors and other healthcare professionals. But the other significant contribution is through the Sathya Sai organization by way of Sevadar. These dedicated volunteers come on a weekly basis or a fortnightly basis and do all kinds of menial jobs to support the healthcare delivery in all these hospitals. Thanks to the Sathya Sai Central Trust for their constant support, which costs over 100 crores each year. Going forward, it will probably be more. The question that I am frequently asked is, where does this money come from? The fact that we need to understand and convey to everybody is that this comes from unsolicited donations from devotees of Baba. And the monies used for expenditure in these hospitals are from the interest generated in a corpus fund. This is important to know and to show the world that this model of healthcare is possible and it can be replicated. The fact that this has existed for over 70 years now is a proof of that. Bhagavan Baba did this out of his infinite love for humanity and to ease their sufferings. Anyone with this feeling can do this. There is no dearth for money in this world. The only thing missing is the love for the fellow human being. To take this healthcare mission to the next level, we now have a memorandum of understanding with two leading universities in the world, one in Tokyo and another in Chicago in the United States of America. The university in Tokyo is called the Tokyo Science University, and in Chicago it's the University of Chicago Medicine Department. This has been made to facilitate exchange of skills and to facilitate research across these three institutions. Dear brothers and sisters, we will deliberate in this aspect in greater detail in the next 2 days at the Sathya Sai Hira Convention Center. I pray to Bhagavan to bless all of us, and I request all of you here, the medical professionals, to hop on aboard this voyage under the direct guidance of Bhagavan Sathya Sai Baba and make your life useful. Jai Sai Ram.